Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 070. A 58-year-old woman came to the gynecological clinic. She complains of bloody discharge from her genital tracts. Menopause is 8 years. Gynecological examination. The uterus is slightly enlarged, dense to touch, with limited mobility. The uterine appendages cannot be detected. Parametrium is free. Fractional curettage of the uterine cavity yields a significant amount of medullary substance. In the scrape, what is the most likely diagnosis? A. Hormone-producing ovarian tumor. B. Uterine cervix cancer. C. Uterine corpus cancer. D. Adenomyosis. E. Choriocpithehoma. Uterine cancer, womb cancer, is a type of cancer that develop from the tissues of the uterus. Types of uterine cancer. Endometrial cancer, forms from the endometrium. Most common. Uterine sarcoma, forms from the myometrium or support tissue of the uterus. Several ligaments support the uterus, including the utero-ovarian ligament, round ligament, broad ligament, cardinal ligament, and uterosacral ligaments. It is further supported inferiorly by the pelvic diaphragm, urogenital diaphragm, and perineal body. Symptoms of uterine cancer. Endometrial cancer, changes in vaginal bleeding or pain in the pelvis. Uterine sarcoma, unusual vaginal bleeding or a mass in the vagina. Risk factors of uterine cancer. Endometrial cancer, obesity, metabolic syndrome, type 2 diabetes. Taking pills that contain estrogen without progesterone, a history of tamoxifen use, late menopause, and a family history of the condition. Uterine sarcoma, prior radiation therapy to the pelvis. Cervical cancer is a type of cancer that occurs in the cells of the cervix. Symptoms of cervical cancer. In general, no symptoms in the early stage. The symptoms appear in the more advanced stage. Vaginal bleeding after intercourse, between periods or after menopause. Watery, bloody vaginal discharge that may be heavy and have a foul odor. Pelvic pain or pain during intercourse. Causes of cervical cancer. Strains of the human papillomavirus, HPV, a weakened immune system, may be more likely to develop it. Sexually transmitted infection, STI, e.g. chlamydia, gonorrhea, syphilis, and HIV/AIDS. Many sexual partners and early sexual activity increase the risk of HPV. Smoking, associated with squamous cell cervical cancer. Diethylstilbestrol, DA, a miscarriage prevention drug. Adenomyosis occurs when the endometrium grows into the myometrium. The displaced tissue continues to act normally, thickening, breaking down, and bleeding during each menstrual cycle. It usually resolves after menopause. Adenomyosis symptoms may include enlarged uterus, feelings of abdominal bloating, fullness, or heaviness, menorrhagia, heavy bleeding during periods, dysmenorrhea, severe cramps during periods, dyspareunia, pain during sex, pelvic pain. The answer is C. Uterine corpus cancer.